It's estimated 2 billion people, a third of the world's population, don't have access to affordable medicines. In the developing world, drugs are often of poor quality or fakes and only available to those who can afford to pay for them. To address this problem, Britain has launched the Medical Transparency Alliance to make such medicines more widely available.
The international community is taking action on different fronts to address each of the challenges, from research and advanced market commitments in order to develop new medicines, to making health services work better through initiatives such as the International Health Partnership, and providing the funding needed through the Global Fund, the International Finance Facility for Immunisation, and the Gates Foundation, to name just a few of the significant donors.
In some third world countries, taxes, corruption and theft often inflate the price of drugs beyond the reach of what people can afford to pay.
The poorest are the hardest hit. Poor people are more likely to fall ill because of a lack of nutrition and a poor environment. When poor people can afford to buy medicine, they use a far higher proportion of their income to do so. And poor people often buy drugs from unlicensed vendors, making them more vulnerable to buying those counterfeits and fakes.
This can be improved by Meta making information about drugs and their distribution more widely available.
These problems, therefore, of price, quality and availability can be tackled by improving the transparency of the systems for buying and supplying medicines. Because once citizens, government regulators, healthcare workers and companies have access to information, they can challenge corrupt practice, challenge excessive pricing and identify the problems of inefficiency and of waste.
To do this, Meta needs to take a leading role in bringing the right people together.
I believe that to really change the way the system works, we need a whole range of people to be involved, from governments to drug manufacturers, importers, wholesalers, distributors, pharmacists, healthcare workers, and indeed civil society representatives. And we do have a good precedent to show that this kind of approach can actually work. The Extractive Industries Transparency Initiative, launched just over 5 years ago, has been a model for the development of Meta. For while the extractives industry and the healthcare sector may be different, transparency and accountability are universal.
Britain has pledged £20 million over the next 10 years to ensure Meta is a success.
The United Kingdom is committed to ensuring, therefore, that Meta is a success. But the future of this alliance is, to put it mildly, in all of our hands. Critically, I think that the strength of this alliance lies in the difference that it will make in the years ahead. For if Meta is to succeed, it will not require governments to act like companies, companies to act like governments, or NGOs to act like either. Rather, it requires each of us to change the way that together we work. In that way, it is truly an alliance of common purpose.
Meta is seen as a way of putting healthcare in the hands of millions of people to ensure the poorest people receive the drugs and treatment they so desperately need.